I had the privilege of being able to have individuals, specifically Nathan Peterson's actually in Africa now. He's one of our faculty members, and he's being joined by Dr. Paul Walker. Just really fortunate to have them on our team. So it's nothing really I did. The only thing I can do is mess that balance up. So every day I pray that I won't somehow disrupt that. And they're taking residents and fellows with them, 3 specifically, and basically to try to multiply, right? Because it takes lots of people to make a difference in the world.
Welcome to Evening Rounds, a podcast that takes you behind the scenes in medicine. Tonight, we're joined by Dr. Alfred Simmental, a world-renowned otolaryngologist who was taught that the foundation of effective physician leadership is clinical excellence and a tireless work ethic focused on a mission of service. There are some things in medical school when you're trying to decide on a specialty, what are you going to be? Well, I learned early on that cardiology was much easier to say than otolaryngology. Now, Alfred, you are an otolaryngologist. I believe I'm saying that correctly. I'm a cardiologist.
That's correct.
This
you
is
did
tougher.
A fine job.
Thank you.
You're getting good at that.
I practiced that all morning and afternoon. So my question for you is, what is an otolaryngologist?
Yeah, so that's a great question. I think it's changed over time. And so otolaryngologist really is the study of like the ears, nose, and throat. And historically, when we also included eyes, used to be eyes, ears, nose, and throat for years, the specialties evolved over time, partially through changes in diagnosis, management, the advent of antibiotics really changed the field. And so previously it was a lot of chronic ear disease, hearing loss, sinus disease, complications of sinus infections, etc. And those have largely went away, also due to changes in our ability to modulate the immune system. And so otolaryngology now includes basically head and neck surgery, which is also surgery for tumors around the head and neck. And some otolaryngologists actually do something that's called skull-based surgery. So they partner with neurosurgeons to remove tumors that both cross the nasal cavity and also the brain.
That's fascinating. So I kind of think of when you said eyes, ears, nose, throat, there's that song, head, shoulders, knees, and toes. That's a lot of different parts of the head that you have to be an expert in. So do ear, nose, and throat doctors, I think ENT physicians, do they specialize in the ears, nose, and throat, or do you sort of focus in on one area of that?
Yeah, so it's called Dura to Plura. That's the new motto, and that's been widely accepted. But
what does that mean, Dura to Plura?
It means all the way from the brain all the way down to the lung. And so we also partner with our cardiothoracic surgery partners. So we're often doing tumor resections that involve sternotomies. And so, so it's a great field to also collaborate with other specialties, right? Because you get bored of just hanging out with yourself. And so but basically, you're exactly right, Anthony, is that the otolaryngologists tend to specialize. You'll have ear doctors that specializes in problems of the ear, balance, etc. They also do lateral skull base for the most part, and so they would have a neurosurgery colleague that possibly would be different than like a rhinologist, someone who studies the nose and anterior skull base. And so they would also partner with a neurosurgeon, which also usually is a different type of neurosurgeon than the one that works on the side of the head.
So ENT means a lot to me personally. I actually have a 7-year-old son who has profound hearing loss and has had numerous surgeries on our pediatric side of the ENT spectrum here at Loma Linda. But I think I'm reminded every day, and I didn't realize this until it impacted my life and my family, just how critical sound is for development, for social skills, for so many different things. And I see the world so differently through how impactful his surgeries and his care is. I don't think a lot of people realize maybe how much is connected and how it's all interconnected and how impactful it can be on someone's life and their outcomes and their mental health.
Yes, absolutely. And anybody who questions that could just talk to their friends who do road cycling who don't hear the Prius coming. And so the loss of hearing is really detrimental. And for kids, it can be a significant setback, like in education. There are robust systems where American Sign Language has really taken a good role. But absolutely, for families that are not accustomed to significant hearing loss, it's going to be a difficult time when you have children or even adults that have hearing challenges. And so we see that. We have the ability for cochlear implantation, which really has established post hearing loss restoration of hearing, and it makes a big difference for those individuals.
Yeah, definitely. So what made you want to study this field long ago? As a med student, as a resident, what was the decision?
Well, that's a good question. And so, I think originally I was going to be a dermatologist because we got this lecture and it said like only these people can do dermatology. And so I didn't know much about medicine. My dad's a commercial contractor. And so I figured, well, that makes sense. I guess I'll be a dermatologist if that's what it requires because I'm right at that line. And so I was going to be a dermatologist, and I met one of my colleagues, Carlos Garbroglio, who is a cancer surgeon from Sloan Kettering, chief of and chair of surgery here at Loma Linda for years. And he is very gregarious, bombastic, right, in his own way. And he tapped me on the shoulder and says, "You can't be a dermatologist. You must be a surgeon. There's nothing else." So I was like, I guess.
Did he see that in you, or what made him say that?
Maybe he just told that to all the kids. But being vulnerable, right? I took that on. So I asked him, where can you do this type? Where do you learn how to do this? And he said, the only place is Memorial Hospital. So I being, again, gullible, I looked up the thing for Memorial Hospital and arranged a rotation. I ended up with...
Where's Memorial Hospital?
It's in Memorial Sloan Kettering Cancer Centers in New York, and so it's a very famous cancer center. I didn't know that at the time. I just was a kid from California, Loma Linda, small school. A lot of them knew about Loma Linda from Baby Faye and things like that. And so... arranged a rotation there. Met a guy named Dennis Krause, who was one of their young faculty members, and also another individual named Ashok Shaha. And just from working with them, it really convinced me that this was an amazing field and that I had to be part of this field.
So I know you as someone who has a tremendous work ethic. Where does that come from?
So that's interesting. So I think that if you ask myself or one of my other brothers, it really probably comes from our family. My mom, they were dairy farmers from Minnesota, so they had a very strong work ethic. Also, my dad being a commercial contractor, there was only work. In work, sometimes you could sleep in till 6, like if you're really tired.
Wow.
But usually it's better to get up at 4 because that's when the day starts, right? And so I think that that was something that was just ingrained in us. And so it really wasn't a choice like to work or not work. It just was. And so, I mean, think that could have its own pathologies too. I figure that's probably why I'm not as fun of an individual, as I see other people seem pretty like they got a lot of fun things they can talk about or do. It tends not to, I don't know. I think that just it's ingrained in us just to work hard. And so it really, I think, comes from both sides of my family.
So was that something you imparted on your children? Was that hard work ethic?
I think not directly. Part of me also thought maybe or had some doubts of whether that was the best way to be raised, because I saw all the other kids around me seemingly having great times, going snow skiing, cycling, all kinds of other adventures that seemingly we felt that we missed out on, right? Because we were always working. But I think that you ingrain it in them because they watch you, right? And
Yes,
so we talk about
yes.
that a lot of, be careful what your little eyes see or your little ears hear, right? And so I think that children really will model themselves after their parents. Now, having said that, if you ask them, they did practice thousands and thousands of hours of tennis and baseball and all of the other things that I felt was important for them to do. And so we also forced them to play piano and use their time wisely. So they would say, yes, we are probably force ingrained some kind of work ethic. And I think by and large, sure, they tend to be fairly productive in different ways. I mean, I think that will be playing out over the rest of their lives.
Yeah, definitely. So you mentioned a little earlier baby Faye, and I feel like you had some really unique experiences in your time here. And one story that resonated with me was your time working with Dr. Bailey and some of the advice he gave you when it comes to leadership. Could you talk to us a little bit about that?
Yeah, so I was part of a thing called Surgery Medical Group, and it was about 50 to 60 doctors. It varied at times. And it was part of the Loma Linda surgical practice. At Loma Linda, the School of Medicine was founded, and then it originally was in Los Angeles and then came to the Inland Empire in the late 60s. And so they had to have a way to develop surgical practices and support doctors that wanted to be part of the education. So I was part of that, fortunate enough to be under Dr. Bailey for several years. And at that time, ENT was a division of surgery, or the surgery group. In fact, general surgery, plastic surgery, urology, they were all small divisions under this large umbrella of surgery. And so Dr. Bailey, after trying to find a permanent chief for the ENT service, there was only 6 of us. And then at that time, we had actually recruited up to have our 7th member.
And when was this?
This was back in 2005. Wow. And so I remember him pulling me aside and saying, now, you're pretty young and you have a lot of your career ahead. And this administrative responsibility really could stifle your future academic progress, right? And so to be careful with the utilization of time, not to have too much administrative responsibilities. You still need to develop your clinical expertise, which you're literally talking to one of the master clinicians. Like even just talking to him was amazing, and still gives me a little bit of goosebumps now, right? Because how special it was to have any time even from an individual like that, and very gracious with his time. But that was one of his comments, is just to be careful to have balance. And I think that's something we all struggle with, balance. And maybe there will be no answer until eventually we're in heaven. Then we'll have the perfect balance.
As a surgeon, we often think of surgeons just chopping things out and the diagnosis is being handed to them. There is a lot of disorders. For example, I'm a little tired today, so I think I have a thyroid problem. It also may be that I didn't sleep very much last night. I don't know. I would like to take this opportunity to hear from you about different screening or risks that we should consider as we in our own lives about our risk for thyroid cancer or thyroid disorders, and what you see, and some words of wisdom you could impart to the listeners this evening.
Yeah, certainly. So a lot of people have concerns with either their weight, their energy, their hair is falling out. Most of it doesn't have to do with thyroid. We do know that about 50% of all Americans have thyroid nodules. Like if we, by and large, decided to go down to the mall and we took a little ultrasound machine with them, we could prompt people to come over and we could talk to them, and we would find out that maybe 8% of them actually had a nodule that needed to be biopsied. And so,
what's a nodule?
So a nodule is just little bumps that are within the thyroid. So the thyroid, think of it kind of like the top of a frog or a lizard. So you have a lot of little bumps on them. And then nodules are when those bumps aggregate and get a little larger. Now, most of those are not cancer. by and large, probably less than 5%. If you told me that your siblings and your parents and your children don't have thyroid cancer. The other risk factor would be remote radiation. Usually it's about a 10-year latency, and it would be low dose radiation. So what you can't choose is your genetics. You certainly could choose your environment. So avoid radiation, avoid heavy metals, other things like that, which you're going to do anyways. And so by and large, most thyroid disorders, you really couldn't do anything about. And we do screen for it by blood tests, just basically to see if your thyroid's functioning well. And I think eating just a regular healthy diet, plant-based, obviously helps. There are some risks with cruciferous vegetables or things that are high in soy. They tend to create goiters, and so because they can disrupt the thyroid metabolism.
So if I have a normal thyroid blood test, if I go to my doctor and say, hey, I'm listening to this podcast, I'm now, I'm concerned I might have thyroid cancer, and I get a normal thyroid test, am I off the hook?
Well, it depends what you get. And so if you get the blood tests, with the exception of hereditable disorders, which is very rare, like if you have medullary thyroid cancer, they may choose what's called a RET gene or to test for something like that. But in the absence of hereditary disorders, what you really need is an ultrasound. Now, some people may say it's probably not best to screen everybody with an ultrasound because, again, 50% of Americans have thyroid nodules in the first place. And so now you use up a lot of resources and the patient's personal angst, right? Because now they know they have something. They don't know what it really means, but you've occupied their bandwidth in their mind of this new disorder that probably won't do anything to them. But the answer would be an ultrasound usually will help you rule out any significant thyroid cancer.
I want to switch gears for a moment. What would the Dr. Simmental of today tell young Freddy 30 years ago? If you could impart some wisdom to young Freddy 30 years ago, what would you say?
Well, I think I would have to plagiarize or basically steal from the people that told me the same thing 30 years ago. And they said, hey, enjoy every minute of your life because you don't get today back, right? And tomorrow, it's never going to get here. You're always chasing it. And I think that that now that my children are older and I've had health issues myself, I think that you look back on it and you said, hey, did I use up too much of my time not smelling the roses, right? And how many people have been told that by people? It goes by so fast. Your kids are small, or don't miss the roses, right? And so I think that I would really tell the students of all young people, smell the roses, enjoy today, right? And don't miss those opportunities to connect with other people. I think that we can get so ambitious and work so hard and just get brainwashed into the working part that we miss out on all the little things. And so I think that unfortunately is the thing I would have to echo. And it's not anything unique. It was the same thing that I was told 30 years ago by other people, right? And so we've probably all been heard that. And so I think that would be the one thing I would really encourage every young individual, but certainly doctor. Don't dream of when you're not attending anymore. Just enjoy being a resident. Enjoy the station that you're at. And people matter, right? So I don't forget them either.
It sounds like you have a real heart, in your leadership role of really developing our residents and our med school students. I heard you have a team headed to Africa here, and you really worked on just developing them in this field. How do you feel about that role?
Well, work wasn't the thing. I had the privilege of being able to have individuals, specifically Nathan Peterson's actually in Africa now. He's one of our faculty members with his wife, Hannah, and he's being joined by Dr. Paul Walker, who's another fabulous individual. And just really fortunate to have them on our team. So it's nothing really I did. The only thing I can do is mess that balance up. So every day I pray that I won't somehow disrupt that. And they're taking residents and fellows with them, 3 specifically, and basically to try to multiply the people that are going to make a difference in the world, right? Because it takes lots of people to make a difference in the world, I believe. And so, I mean, it's probably why Jesus Christ gave us 12 apostles, because he couldn't, or while he was on this planet, he couldn't do it himself, right? And so I think that's really our goal. But the answer really to your question is that it wasn't something that I totally had to do, but I knew that I had the moral obligation to facilitate it, right? And not let it die. And a lot of the young people, they really have that in themselves also as well already.
That's it. It's actually a really compelling thing you just said there about leadership, which is it's not what I'm doing, it's what I'm not doing, right? I'm not getting in the way. I think that is really, really a powerful stance to have when it comes to how you view your department and how you view that education and that development of those coming up behind us.
Yeah, absolutely. It's certainly a team effort.
Yeah, it's wonderful to see. I mean, that's the foundational tenet for which this system was built. Our original name was College of Medical Evangelists. My grandfather, I'm fortunate enough to be a 3rd-generation graduate of Loma Linda, and my grandfather graduated from College of Medical Evangelists. And we can get very focused on what needs to be done here and lose sight that there's a calling that's bigger than ourselves, and it's to the rest of the world. So I think it's really awesome what your faculty are doing, and you as a leader are getting out of their way and supporting them from saying, this is important. We will support you in this effort, whether that's blocking clinics or facilitating coverage issues and things like that. I think that's a beautiful thing.
Yeah, and I think it's been relatively well received. I mean, the residents, they really, if they get a chance, they want to go on another trip, right? And so it's not something that most probably trainees are exposed to. Now, having said that, I do believe that across the country in the world of medicine, we have discovered that service is a good way to help our trainees at least embody empathy as much as we can, but for sure understanding, but also employ within themselves the desire to help the greater world. I mean, it's not just an accumulation of trinkets and goods, even though that could be, everybody needs to have resources. But I think that service is something that's really critical. And I think that's what helps most doctors. I know I see it in Dr. Hilliard Anthony all the time. I mean, he really cares about his patients and goes the extra mile. And I think most doctors will, really, if you ask them.
Well, I mean, without patients, there's no doctor, right? So I mean, I think of it as not only a moral obligation, but it's in our definition of who we are, right? Yeah. And the patient is our North Star. I think that segues very nicely into a question I have for you. We haven't touched on the fact that you've pursued a business degree and an MBA and have done a lot of thoughtful study on the current economic and healthcare climate that we face ourselves, that not just Loma Linda, but the entire nation. The question I have for you is, what do you see as the biggest hurdle facing a healthcare system to deliver care to those who come and seek help?
Yeah, I mean, I think that we all struggle with that, and I certainly don't have the answer. We certainly have thoughts, and I think the biggest hurdle is always going to be resources. We have a resource-intensive business, right? Whether it's actually devices, product, labor is certainly expensive from top to bottom. And so I think in healthcare, if you think of it as a right is interesting, right? Because the right is something that you can't transfer or you can't sell. It's inalienable. You can't take it away, right? But and we do believe that people should have this. The hard part about healthcare is that it requires other people to do things for you, whether it's a med tech to run your CBC, if it's a phlebotomist to draw the blood in the first place, somebody to clean the place where you're going to receive care, and all the way up to eventually the physician, right? And so it requires someone else to do something for you. So if you think of any other what we would call an inalienable right, healthcare is hard to nail into that category, even though everybody believes that we should have access to those types of things. So I think that just the funding of healthcare is difficult, and especially in the United States, we let people have freedom of choice, right? And so you can eat or do whatever you want. You can get out and bungee jump. You can rock climb and snow ski, get injured. There's many things that we do. We enjoy those type of things, right? And so, and rightly so. And so I think that's going to be the challenge, is how and who funds the endeavor of healthcare.
Yeah, I was hoping that you had that magic comment that if you do X, everything will be fixed. But it is certainly a challenging topic that many people, I think, are thinking of. One question I always like to ask our guests on our Evening Rounds podcast is, we spent a lot of time thinking of the name Evening Rounds. And to a physician, we all understand what morning rounds are. It's meeting the patients, getting the things in action going for the day before you're in the operatory or you're in the cath lab or they're going for x-ray, things like that. Evening rounds may take a slightly different meaning depending on who you ask. And so I would like for you to tell us, when you hear the term evening rounds, what does it mean to you?
Well, that's interesting. And I've enjoyed seeing all the different renditions of the rounds. So evening rounds, I think, is a little bit different. That's kind of when you're tucking people in. And I think a lot of times we forget to tuck ourselves in, right? And so, and we're trying to train our trainees to do that. Yeah. It's kind of like a self-check of all the things that happen during the day. And, again, going back to the honor of being a physician, our patients heal us just as much as we heal them, maybe more so, right? And so a lot of times you'll just really, I see evening rounds as being a chance where you can kind of reflect on what happened during the day, the things that were meaningful, there's good and bad, right? And so I think it's kind of like that self-reflection where you have a chance to kind of reconnoiter the whole day, right? And so basically make sense of it. And really, again, it's a chance for you to try to worry about yourself. I see that as being critical. And it's a time when you can just ask God, like, hey, did I do a good job today? If I didn't, help me to do better tomorrow than I did today, right? And so that's kind of what I see when I think of evening rounds. That like kind of pops into my head.
That's beautiful. I've taken away from tonight to make sure I stop and smell the roses, live for today because tomorrow isn't here yet. Ask God to help us be better every single day, and that our patients sometimes teach us more than we teach them. So, Alfred, I can't thank you enough for joining Kelsey and I tonight on Evening Rounds.
Yes, it was wonderful. Thank you.